this presentation on Aftercare, who takes care of you after a crisis. I became interested in this concept after I personally experienced a crisis on my campus. Unfortunately, one of my resident advisors committed suicide right before fall break 2 years ago. When some concern was voiced over his whereabouts, I performed a welfare check and with another professional staff colleague, and I was the one that discovered his body. I was very close to a staff member, and I can honestly say that I had no idea he was in crisis. While I managed the visions of what I saw and the grief that I felt, I was also dealing with the emotional aftershocks that my community was experiencing. I felt like I was the only person who could respond to my staff and student needs. I wouldn't take time off or give any responsibilities. Luckily, my department was very protective of me, and they literally stole duty from me and told me that I couldn't do duty, and they actually made my first counseling appointment for me, and I'm very thankful to that because it really set me on a road to taking care of myself. And since then, I really have been working pretty hard to try to make more time for myself and take more balance. And so this presentation is really dedicated to all of us who have been through a crisis like this or even worse, and who continue to give all that they have until they have nothing left for themselves. So let's begin. There will be 4 learning objectives to this presentation. First, participants will be able to identify the types of crises that can occur on a campus. Participants will be able to understand the emotional and physical effects of experiencing and managing a crisis. Participants will learn about compassion fatigue and how it can affect job performance and satisfaction. And lastly, participants will learn how to advocate for their own self-care. Before we dive in, I just want to give a sort of a shout out to Jim Rooney, the Associate Director of Residence Life here at Urbana Champaign. A month ago, he gave a presentation on crisis management, and I ended up taking a lot of the resources that he gave to add to this presentation, and so I just wanted to send a thank you to Jim Rooney now. Okay. There are lots of possibilities for what we could experience on our campus. In crisis management, responding from the heart, Eugene Zdarsky defined campus crisis as an event, often sudden or unexpected, that disrupts the normal operations of the institution or its educational mission and threatens the well-being of personnel, property, financial resources, and or the reputation of the institution. He identified 3 levels of crisis, the first being disasters. So these would affect not only the campus but the larger community. The most obvious would be natural disasters such as tornadoes, hurricanes, earthquakes, things of that nature. The second level was crisis. This would affect the institution but not necessarily the outside community. Crime waves, active shooting, epidemics, these are the kinds of things that would affect the population of the entire campus. The third level is critical incidents. This is where there may be a disruption to a department or a specific college or maybe a segment of your college population, but the rest of the institution is able to function without interference. An obvious example of this would be maybe a student death where maybe a student group is affected, maybe a residence hall is affected. The larger campus runs smoothly. And I'm going to add one more level. I know that I'm not an expert, but I do think that helping students through individual student concerns can become a level where you're focusing on a specific student with depression or maybe anxiety, their family issues, or their social relationships, roommate conflicts. In both the critical incident level and in the managing student concerns, practitioners need to be empathetic and handle these issues with care because, unfortunately, if they're mismanaged, they can lead to larger issues. In many cases, we experience the disaster or crisis right along with our students. This can be a traumatic event for us as well. And unfortunately, we tend to put so much focus on our students that we forget our own care. There are 4 types. Actually, let me back up. A traumatic event can be defined as any event that causes unusually strong emotional reactions that have a potential to interfere with the ability to function normally. Frankly, it's normal for people to experience emotional aftershocks when they have passed through a horrible event, and this is referred to as a stress reaction. And we need to be aware that these things can happen to us as well, not just our students. There are 4 types of possible stress reactions: physical, cognitive, emotional, and behavioral. This is a list of some of the physical signs and signals that stress may cause. Some of the most common are things like nausea, fatigue, headaches, elevated blood pressure, grinding of teeth, You may experience one of these or maybe a few of these, and it's important to recognize them as a stress signal and not maybe explain them away or give them some other rationale. Here's a list of the cognitive signs and signals. For me, these are actually the most difficult for me to experience. When we're in a crisis, we need to sometimes feel like we're superhuman. So if we're forgetting meetings or details or, making poor decisions, that is almost unthinkable to us. And we really blame ourselves for our behavior. But we need to give some space to ourselves to be a little patient with ourselves. That these kinds of things, or this kind of confusion, poor attention to detail, poor concentration, is a normal stress reaction to trauma, and we need to experience that and be okay with what we're feeling. For me, intrusive images was a real problem. So anytime someone asked me, "Are you okay?" I saw my student the way I found him, and every time I had to talk about it in a debriefing meeting, or anytime a student asked me about what happened, I could see it as if it had just happened, and my body responded to that stress with fear, rapid heartbeat, and panic. It almost felt like a panic attack. And so when I was in counseling, I did a lot of work to when I saw those images, tell myself that I'm okay and that it's not a new thing that just happened. And so if this should happen to you, you may need counseling in order to help yourself get through it. Here are some of the emotional signs and signals that I think are pretty familiar with when we're working with crisis. You just feel like you have zero control of the situation, and that can lead to fear and guilt and grief and panic. When I was preparing for this presentation, I sent a short survey to my colleagues here at U of I as well as my committee, just kind of asking them about what kinds of stress, what kind of crises they've been through, what kind of stress reactions that they've experienced, and how they get through it. And their words are going to be throughout this presentation, starting now. So here are two resident directors who are new in their careers, where the first one, she's talking about really just having a crying breakdown over having a student and being worried about them. And in the second, we have a student who, or a resident director who's telling you that they have really a difficult time leading things at work, and they have a tendency to get emotionally overdrawn or exhausted in the aftermath of certain crisis situations, especially sexual assault, suicide, and death. And lastly, here are some of the behavioral signs and signals that are common with stress, and I want to talk about two of them in particular. The first is hyper alert. This is where you throw yourself into your work. You have just a ton of energy while you're working through those procedures. You don't let yourself rest. You don't think about your emotions. You just run until you can't run anymore, and then that leads to exhaustion. And the second is withdrawal. This is where you may get to a place where you feel like no one can understand me, no one can relate to what I've just dealt with or what I'm seeing. And so you start to feel like you have no one to talk to, that there's no one that will really understand you, and that can lead you to withdrawing from not only your personal relationships, but also your professional colleagues as well. And here are two quotes that represent both the hyperactivity as well as feeling withdrawn from the people that are around you. And here is a good place to stop for some initial questions. So I'll take those now.
Great. If anybody has any questions, please submit them on the question box in writing. Or if you would like to ask a question verbally, I'll give you an opportunity to press the raise your hand button on the GoToWebinar interface, and we can call on you to ask a question verbally if you'd like. Okay, no questions so far have come in. If you do have questions, please feel free to submit them again through the question box throughout the presentation, and we can ask Arianna the questions as we go. So Arianna, why don't you continue?
Okay, thank you. So now I'm going to kind of switch focus to a concept called compassion fatigue. So compassion fatigue is defined as a natural reaction to exposure to experiences and feelings of a traumatic event experienced by another person. For example, let's say a student who you advise in a student group maybe comes to you and tells you that maybe last year they had been sexually assaulted. Immediately you might feel sadness, anxiety, fear, guilt, anger, or a whole list of emotions that I can't even think of. Additionally, if you have any personal or professional experience with the situation, this student's story is going to bring all that up for you. And that is basically what compassion fatigue is. It's vicarious trauma. So it may not happen to you directly, but you are experiencing it right along with the student. It has a tendency to impact individuals who are involved in the lives of people who have experienced a traumatic event or sudden loss. And in a real way, this is our work. We may not be counselors directly, but we do a lot of counseling to get students into counseling. And so we hear their stories and we hear their fears and their emotions. And sometimes we take those on to ourselves even if we don't realize that. So here are some quotes. The one I wanted to kind of point out with is that there really is a real interaction between the stress and exhaustion that exists with the satisfaction of helping people and helping to resolve a crisis situation. I mean, you feel good about helping a student, and I think that good feeling has a tendency to overshadow maybe the real tiredness that you feel and a real sense that I don't have anything left to give, and sometimes we can just focus too much on that good feeling and not check in with how we're feeling, and I thought that was a good quote to represent that. So let's talk about how does this affect us as practitioners. In a real way, compassion fatigue resembles the first-hand reactions that I previously talked about. So all of the behavior, all of the physical, all of the cognitive, all of those things you can feel them even if it's secondhand. And this really could lead to you having difficulty in the work that you have or with the colleagues that you have. And so, for example, like your coping mechanisms might be overwhelmed. You have a reduced effectiveness as a caregiver. Helplessness, a detachment from coworkers, attachment from family and friends. You might experience a cynical nature about the work that you do, feeling like you can't make a difference. What I do is pointless. You might have real apathy about the life and the world around you. You might experience staff conflict, poor productivity, and frankly, you might experience shortened tenure as service providers. I mean, many resident directors leave their positions, and when you ask them, after a few years, when you ask them why, they usually respond with something like, I just can't handle duty anymore, or I can't be around students all the time. And maybe what a lot of that is just that they just don't want to be experiencing the stress that they've experienced and as it being a first responder to a crisis situation. So in this quote, you're talking about thinking about suicidal ideation attempts. I'd obviously be with the student, perhaps talking to them in the hospital or counseling center right afterwards. And then after that meeting, you have the follow-up and the paperwork and the meetings and the dealing with the fallout around the residents' friends, and those things take a toll, and they'll say just feel weary of all that stuff. I thought that was a real good example of what you could get to if you feel like you're not taking any time for yourself. So here, I want to talk a little bit about what are some things that an institution can do to prevent compassion fatigue among themselves and their staff. And I really collected these from the resources that I read at the bottom, which I have listed, as well as my own experience here at U of I for things that we do in order to take care of our department. And I've broken them into 3 levels, so pre-incident, during the incident, and the incident follow-up. First and foremost, in any crisis management plan is, of course, planning and preparation. So your campus probably has an emergency action plan or a crisis management plan that has details for the most likely events to happen on your campus, as well as a basic plan or a catch-all for all types of situations we may not have thought of yet. Please, these plans should be keep it simple. These plans should be really easy to follow. In most cases, people will not have their large binder of resources at their handy when they're ready when they're in a crisis, and they may not even have time to read them. So these plans should be so easy that you could follow them almost instinctually. Which brings me to training. There's a phrase that I always mess up, so forgive me, but it goes something like, in a crisis, you will fall back on your lowest level of training. People need to feel like they know what to do in a crisis. If they feel like they have the steps they need or the procedures they need, the resources they need, they probably won't feel that helplessness and feel that adrift feeling after the crisis is over. So training is huge in getting people to feel confident in what they're going through. And also giving them an idea of what to expect. So doing activities where you do role play or tabletop activities where people can get a real sense for what are some of the things that might happen, what are some emotions I might be feeling. Those types of activities can really help a practitioner prepare to deal with it in reality. Third, strengthen connections with campus partners. In a crisis, you're going to need to be able to coordinate, to communicate, to manage tasks. And if you have support relationships already built up, then those are going to just help you through the crisis, and that's going to make your practitioners who are first responding feel so much better about what they're doing and the results of what they've dealt with. And the last is create policies for self-care for first and secondary responders. This could be anything from setting short shift limits to managing if you have someone who's been on duty through maybe such as, for example, a student death, then maybe they're not on duty for 2 more weeks. And create real simple policies to follow so that supervisors can tell their colleague who just went through a crisis or who just was going through a student death that they, hey, this is a policy on record. You have to wait 2 weeks. This is for the well-being of our university to make sure that you get your rest. And that way the practitioner doesn't have to feel bad or guilty or feel like they're not strong enough. So putting that stuff in place can really create a culture of care at your institution. Second, during the incident, it's important to determine the scope and impact of the crisis. If you have an event where it's going to take a long time to manage and do all the follow-up and it's going to impact a lot of people, you don't want to bring in your entire staff, because if you do that, then there's no time for rest, there's no time for breaks. And so it's better to bring in your essential personnel you absolutely need and then let everyone else rest so that in the morning you can switch and have your people who've been up all night maybe get some rest and get a real break from the situation, which leads me to time-limited shifts to manage exhaustion, which I think speaks for themselves. You want to mobilize your resources and support networks to help you restore order and routine. Maybe divide out tasks that are, your normal everyday room change requests and just everyday meetings to other people who aren't maybe responding to that duty and kind of sped up. And then, of course, give duties within the scope of your staff's training and experience. When I was a grad student, I was asked to evaluate whether or not a student was safe to live in the residence halls after making a suicidal ideation threat. That was not within my training or my experience, and it led me to feel a sense of responsibility that I really had no business feeling. And so I really encourage you to really think about, is your staff trained to do what you're asking them, and are they going to feel, too much about what they've been given? And then the last is the incident after the incident, what you do to follow up. The first big one is debriefing with your staff. A situation is not over until you've talked to the first responders on scene, including our students. We need to make sure that they're feeling okay with what they've just seen or experienced. That they feel like they have the support that they need. And this can really give your staff some closure. Along with this, really encouraging your staff to take part in events that can add completion to an incident. I'm going to use the student death example. Encouraging staff members to go to a funeral, for example, to go to the services, to put some closure on what they've experienced, sometimes can be very helpful. Supervisors should really pay attention to their staff's stress signals and signs. See what's going on, get a read for it. Be intrusive. We ask our students all the time, our parapros, to look for behaviors that are unusual and to ask tough questions for their residents and let us know if there's anything going on that we should know about. We should really be doing the same thing with each other. So if you have a staff member who just went through a really difficult duty night and now they're not sleeping or they're hyperactive or they're withdrawing, we need to ask, are you okay? What's going on? What can I do to help you? They may tell you to leave them alone, and that's fine, but at least you put it out there and that you're offering support. And the last one is role modeling self-care. So if you're telling your colleagues that it's important for them to get rest after a crisis, then you have to do the same thing. Because if you say the whole time, then it just teaches your students or it teaches your staff that they have to do the same thing. And that is not encouraging a culture of self-care. So it's really important that we role model our behavior to our staff and that our institution role models that for the practitioners that are in our hierarchy. So now I'm going to switch gears a little bit to talking about, how do you advocate for yourself and your own self-care? Because if you don't do it, then potentially no one else will. And it has to be something that you become confident in doing. And this is going to take practice. I am definitely not good at this 100% of the time, not even 85% of the time, but I'm working on it, and I think that is what's important. So the 6 that I've listed here are just things that I've learned in my short career, and I'm going to offer them to you as well as what the research is suggesting. So the first one is beginning with you. And what I mean by that is to really start to take self-care, you need to understand what you're feeling, what kinds of stress signals and signs are common to you, what do you feel is the problem, what is causing your stress systems, really where are your thoughts coming from? And so if you're having harmful thoughts or if you're having feelings of guilt, where are those thoughts coming from, and really understanding that. And this is where counseling can be extremely effective. We encourage our students to go to counseling all the time. Like if they're having difficulty with their classes and they feel stressed out, we offer the counseling center. If they feel like they're in a romantic relationship that's ending and they're feeling lonely, we offer the counseling center. Why don't we take advantage of that for ourselves? Many of our institutions have employee assistance programs. And so using those or using outside resources, going to a counselor can really be a great way to provide a safe space for yourself, to provide perspective, and to really figure out what you need to begin your healing process, I think is huge. 2, let me switch slides. It's important to communicate with partners, family, and friends. I think a lot of us, sometimes we don't think about if you have a partner who's live-in and then you get a duty call at 3 o'clock in the morning, your partner is going to respond to that. They may have the same type of stress signals that you do with heartbeat, and you're worried about your partner going into, God knows what, and what crisis. And so I think it's really important to communicate with them, to communicate to your family and friends about what's going on with you. Not only does that help them feel more connected to you, what you're going through, but it also allows you time to debrief with people that may not be connected to the institution, and that can give you a real sense of support. And there's a quote here that I pulled up too about, someone being able to go to their partner and talk about what's going on, and if they aren't able to do that, that they would feel like that would be a major struggle for them. Okay, this third one is called Take Team Approach. I really like this picture because I feel like it's people leaning on each other to get a job done, and that's what we need to do as a staff. We need to communicate with our peers about what's going on with us. We need to say, I need you to help me, or if someone offers help, like what can I do to help you? Take it. Give them something to do to help you. Don't be afraid to do that. Everyone has something to contribute to a situation, and you can really maximize your response to a crisis if there's more people helping you. And so I highly recommend this. And from our senior assistant director here on campus, he talks about how his role, he doesn't necessarily handle the everyday crisis, but then he can take on, the little stuff, the things that that still need to get done, but maybe doesn't need the focus of the primary responder. So that is a great way to handle a crisis situation, so that you don't feel overextended in the work that you're doing. 4, speak honestly to your supervisor. I think this is a big one. I feel like this takes a lot of trust, and sometimes you don't feel comfortable talking to your supervisor. You don't want them to think anything less of you. You don't want them to judge you. Or you may not be comfortable talking about your emotions or how you're feeling to your boss. This may not be something that is culturally that you will do. It may not be something that you feel comfortable doing in general. And at the same time, though, if you don't explain to your supervisor what's going on with you, it's hard for them to know. I mean, they're not mind readers, and if you need to talk to them about what you're feeling and what you need, so that your supervisor can help make decisions can help you prioritize your tasks, or maybe get you out of meetings if you need to work on room change requests after handling a bad duty night, for example. You need to talk to your supervisor, because they can really help you maintain a balance, and they can really explain to them like what's going on with you. So if you're being forgetful, it's not because you're being a bad employee or that you mean to slack off. It's that you're going through a difficult time right now and you need their support. And I think most supervisors, especially in our field of higher education, would be more than willing to help you as much as they can to help you get back on your feet. Learning to say no. I have to admit that I feel a little hypocritical with this slide, because I struggle with this very much. And I think many of us do. I think in student affairs we have a tendency to keep giving until there's nothing left to give. And frankly, that's kind of sick thinking, because it allows us to overextend ourselves and to get exhausted. And that's something that we would preach to our students, and so we certainly shouldn't be role modeling that for them. And I think the first step, I think, to becoming better at learning how to say no is learning why you don't say no. Is it because you feel guilty if you say no? Is it because you want to put other people's needs first? Is it because you feel like no one can do it better than me? Or maybe it's something where you feel like no one is going to step up if you don't, and so you'll do it. But that type of thinking is faulty. And it can really create a dangerous situation. If you are exhausted, it can lead you to just leave your field altogether. It can lead you to make bad decisions. It just takes you to a really exhausted place. So it's important that we really set professional boundaries, and personal ones for that matter, and stick to them. And that means we have to learn how to say no. Recently I was watching this YouTube video about saying no when I was preparing for this presentation, and there was a speech therapist who was talking about how she learned how to say no. And she basically tells her patients, and she does this herself, that she puts her tongue at the roof of her mouth, which then when you try to talk makes kind of a "nuh" noise, which gives you a second to say no when maybe your initial reaction was to say yes. I thought that was pretty funny. But I'm going to try it because I think I could use some more techniques than saying no. But this is just about setting boundaries and making sure that you're in a good place. And 6 is find the methods that work for you. Not everyone is going to have the same activity or the same plan to reduce stress or to take time for themselves. And so you really need to get a sense for what is going to make you feel better. For some people, that's going to be taking maybe a nap midday. For some people, that's going to be working out and keeping an exercise routine and a nutrition routine. It could be spa treatments. It could be dancing. It could be journaling. It could be vacations, so you take time off. It could be reading, just diving in to the work or to a good book. Or, I mean, it could be something so simple as going to church if you're religious, or taking part in spiritual traditions. Having spirituality can really help actually through a crisis, because it gives you a larger purpose of what you're doing. It can make you feel as a practitioner that you're contributing to a larger good. And a lot of times, some of the research is showing that practitioners with spirituality of some kind tend to fare better when it comes to vicarious trauma, because they have an outlet for what they're experiencing, and they can go to church, they could go to their God in order to talk about that. And I think spirituality can be help for a lot of people, but not all. So you have to find what it is that works for you that's going to make you feel better. So I'm going to take another set for questions.
Okay, if anybody has any questions, again, please type them in the question box. Or if you would like to ask a question verbally, please press the raise your hand button on the GoToWebinar interface. Also, I'm sure that if anybody has any tips or suggestions they'd like to share or thoughts on the material, I'm sure that Arianna would be open to that as well. So if you'd like to do that, please feel free to submit tips, suggestions, stories, experiences, anything like that to contribute. Arianna, at the beginning of the presentation, you mentioned that you had gone through a tough situation where somebody in your community had committed suicide. What year was that? Was that recently?
That was 2 years ago.
2 years ago. And how long would you say it's taken to really kind of come to terms with that and get over the initial stress?
It took me about 6 months, I think, to get past the initial panicky attacky feeling. I'm gonna be honest. I'll be very honest. Because I think this is an important topic, but I was having difficulty walking in my building, like in the hallways, because I felt like I was constantly going. Every time I was going to a room, I was like afraid of what I was going to find. And it took me about 6 months to work through those feelings. But I stuck it out and kept doing my job as normal, which I don't know is necessarily self-care, but at the same time, it was important to me to keep my routines and prove to myself that I could do it. And so I did. I'm still in the same building that I was in. However, I still get triggered about student suicide, and so I still get a little emotional. I still cry a little bit in meetings. And I just try really hard not to make a scene, but I'm okay with feeling what I'm feeling, and my department has been extremely supportive. And actually, just this past October, I actually had another student suicide in my building. A student jumped from a the 9th floor, and passed away. And I was pretty involved with helping my community heal, and I even took students to the services. And but it's really hard for me. But at the same time, I've put into place some ways to take care of myself, and I've learned what works for me. So it's really important to me to talk about it with my supervisors, and it's important for me to research suicide. So I've done a lot of work in research and suicide to really understand it as much as that's humanly possible. And then I went back to counseling for a little bit after the suicide this October, just to make sure that I was still on the road to recovery and I was still okay. And so it took me a long time, but at the same time, it made me a better professional, and I think it's made me more aware of the possibilities, which I think is going to make me better in the long run.
Yeah. I think that just further highlights the importance of taking care of yourself as a professional, just since we're the ones that get leaned on so much. I think that probably the biggest experience that I've been through similarly was I was a staff member at NIU during the shooting in 2008, and looking at the attendee list, I'm not the only one that's logged in right now that was there at the time, but it was one of those that did require months and months of realizing what I needed to do to take care of myself. And part of that time was just like, no, I can't take care of myself right now. I have to take care of others. And it was a stressful situation, and I still have triggers from it. But I think that it just highlights the importance of taking care of ourselves as professionals so that we can be there for others and we can be effective in our jobs.
Absolutely. I mean, I think we need to be okay with not being superheroes. We can't fix everything, and we're going to go through some difficult things with our students, or we're going to experience it ourselves because we went through a student shooting. And unfortunately, these things are happening across the country, and we need to be okay with giving ourselves some space to heal. And I mean, in my case, I was very hesitant about self-care. I mean, I did not do a good job at the beginning. I'm just really lucky that I had a department that made it its priority to make sure I was okay and to put the resources in place and kind of forced me into it until I was doing it myself. And I think sometimes that's needed to, when a person's in shock, they're not making the best decision. So sometimes an institution may need to step up and say, no, you need to take duty, or you need to get rid of duty, or no, you cannot continue your job without going to counseling. That didn't happen to me. But at the same time, if you have a staff member who is not doing a very good job and you know it's because of a crisis, you need to put that out there. I don't think there's anything wrong with putting out there that it's okay to get counseling and that you should be doing everything you can to make sure that you're healing. That's just going to make you better for your students and for yourself in the long run.
Absolutely. Well, we haven't had any questions come in, so I think we will probably wrap up the presentation here. I want to thank everyone for attending. I also want to thank Arianna for presenting today. She didn't mention this, but there was a last-minute change in the presentation. She did have a co-presenter that wasn't able to join her today. So congratulations on a successful webinar. You did a great job, even flying solo today. For everyone in the Midwest, good luck shoveling out or scraping the ice off. And for those that are attending the Glucujo Winter Meeting next weekend in Indiana, safe travels. Thanks again for attending. Be sure to look for this webinar on the webinar archives on the website. Have a great day, everybody.